Great. Thank you so much, Alexis. And thanks for those comments too of enthusiasm. This is an incredibly exciting field to be a part of and a really big impact on our patients. So our mission, and I think I share this for everyone, not just Corey Health, is to give every person the opportunity to benefit from cardiac rehab participation. I want to walk you through a patient example and journey so that you can really understand what it's like to be a part of the Corey Cardiac Rehab program. Derek's a 52-year-old firefighter. He unfortunately suffered a heart attack and was referred to cardiac rehab, but much as we discussed, he had many barriers to going to a center-based program. In fact, getting time off from work was impossible for him at the firehouse. The center was actually more than an hour away from his house, and the copay, the gas to get over to his cardiac rehab center, and then adding on top of that, his just additional costs of being off work were just too much for him. And unfortunately, he wasn't able to participate until now, until we've offered a solution where really putting patients and giving them cardiac rehab sources and resources at home is making a big difference. So Corey uses a smartphone application that I'll be walking you through that is cooperative with a smartwatch and a blood pressure monitor so that patients can really start engaging in guideline-directed care and supervised exercise while they're at home. They also have a chance to get a resistance band to do extra exercises and a pill box to help keep them on track with their meds. All the health data from Corey flows to the clinician dashboard, and it works as a portal for that Corey coach to be able to keep that patient engaged, supported, and encouraged throughout their experience in virtual cardiac rehab. It's a 12-week program where we start by engaging our patients. We get them started with the technology. We really focus on making sure that there's virtual support for them when they need it. And then we coordinate their care with community resources. We keep them empowered and engaged in the program. And we help this to be something that becomes a lifelong heart healthy life. It starts by identifying what patients would actually benefit from the program and be eligible. So we have an Epic-based trigger as well as a data filter that really allows us to identify who's meeting the ICD-10 codes. Like, for example, they had an aortic valve replacement, they had an MI, heart failure with reduced EF, that would allow us to know that they'd be eligible for this program. We use inclusion criteria using best practices from the AACVPR that based on age, heart function, and lack of any lethal arrhythmias like VT or VF. And then, of course, whether they have technology or they're interested in using a loaner device in the program. And then we start getting them into the program and getting started. The first thing, of course, is meeting them. So whether we're meeting them in the hospital after they've had an MI, for example, with Derek, he's had an MI and we're introducing the program to him for the first time. When he's ready to get started, we get his email address, and through an email, he's able to download Corey onto his phone securely through the App Store or through Google Play. Then what we do is we have our patients go and do one center-based session where they can get a health assessment to make sure that they're safe to participate and they're low to moderate risk for doing this exercise at home. It's also a great opportunity to set those exercise goals and prescriptions so they know exactly what they need to do as they're heading home to start the program. Let me show you what it's like to get started with Corey. First, what we do is we get that patient onboarded, whether it's iOS or Android. They start setting up their account by enabling notifications so that those calendar reminders and those other reminders come up easily on their phone. Then they start personalizing the experience. They put their photo in. They're also including risk factors like if they're a smoker. And then we make sure to address social determinants of health. So here we ask about if they have trouble affording medications, transportation, or other issues that we can address early on. Now we get them comfortable with the technology and the wearables. So we have tutorials that help walk through how to use a blood pressure cuff, whether it's iHealth or Omron. We support multiple blood pressure devices. Then we want them to get comfortable with the smartwatch. What we have them do is show that they can easily click off and track their medications on their smartwatch. We make sure they feel comfortable with developing that digital health literacy. We also show them where their heart rate can be tracked and what a safe range is for their heart rate. We also show them how to do workouts and set that through their watch. So whether they're doing an outdoor walk, for example, they can get started and get that going easily. So once they've got the application and they have their wearables, they're ready to start the program. We have a Corey coach who provides health coaching and keeps the patient on track. So for example, Derek's going to start his first exercise opportunity, and he's going to be coached in order to make sure that he's safe and excited about what he's going to be doing. The coach is also there to help answer questions, whether they're about how to use the application or just about questions regarding his management. He's empowered through this health coaching, and it's really quite an important part of his experience. Let me show you an example of what virtual support is like. Here's an example where we have a structured exercise session at home. You can see Derek scrolling through, and he's going to take a walk. He first answers the complete to the safe to participate checklist to make sure he's not having any symptoms and his vitals are in a good range. Then he clicks getting started. And you can see as he's about to get started here, he can have an option to actually do this with an American Heart Association trainer. So this is a really cool session where he's going to walk with Leslie, and he's going to get the opportunity to get tips on heart health and follow this along with a smartwatch. From our dashboard, we're able to follow and see what Derek has been doing in terms of his exercises. The exercise chart gives us an at-a-glance view of what types of exercises that he's been doing throughout the program. And there's a way to take a deeper dive by clicking on one of these exercise histories to really get the details of what he's been doing with each exercise session. Duration, frequency, and pre and post vitals are part of understanding what his workouts have been and how he's been doing to provide feedback. That's an example of virtual support during a structured exercise session. Now, it's so important when Derek's going through recovery after a heart attack to coordinate care, whether it's making sure he's on guideline-directed medications and keeping up with that, following up with cardiology primary care, making sure he knows how to check his blood pressure, or keeping up with his exercise and healthy lifestyle. Derek has a lot of care coordination, and we're here to help through that. Let me show you an example of how we help him go through care coordination. So let's get started with vitals tracking. He's going to be using a blood pressure cuff at home to keep track of his blood pressure. And here what we do is we walk through step by step how to take a valid blood pressure, everything from resting for 5 minutes to making sure that the arm's at the level of the heart to actually holding off and not talking while they hit the start button. Once they go through this process and they hit collect a blood pressure, it automatically syncs with Corey. Then they can enter their heart rate or have the heart rate flow through their smartwatch. We also track mood, so we can keep track of how they're feeling. And then we also have the ability to either sync with a scale or enter the weight manually. So patients at a glance get an idea of how they're doing from heart rate to blood pressure, weight, and step and activity count. Then importantly, we keep them on track with their medications. So aspirin, their statin, Plavix, lisinopril, these are key medications after suffering a heart attack that they need to be watching out for. And not only tracks, but it keeps them informed on why they're taking these medications and common side effects. And it's all written at the 6th grade level. Now, as we flip and we focus from the clinician or the coach's view, we get a look at a glance at how our patients are doing at 7 days, 14 days, or 30 days. And this gives us a really accurate estimate of how they've been doing during that recovery time. And is there anything that we could get better on in terms of guideline-directed medical care and goals? And so as we look down through heart rate, blood pressure, and steps, our eyes might see that his blood pressure has been trending in an elevated range in the 150s to 160s. We know from guideline goal, we're trying to achieve less than 130 over 80. So this actionable insight is a way for us to be able to work on adjusting lifestyle like DASH diet and maybe addressing that medication management at his next clinic visit. We also can take a look at steps and see how his activity goal is going, making sure that we're able to positively reinforce and then also give him opportunities for improvement. Now, as we take a look at his medications, we can see that overall, he's been around less than 80% over 3 days, 7 days, 2 weeks, and a month, just looking at this brief review. And as someone who has had a stent after a heart attack, there's some concern because it looks as though he hasn't been 100% adherent to his DAPT. He's also missed his statin on several days. And so again, for our guideline goals, we can explore how to address barriers to DAPT, as well as his atorvastatin, as well as blood pressure medication control. Now we can flip to education as well, or we can jump in and see how he's doing with his own health report. So what's really great is that patients have a chance to click on their own key cardiovascular metrics and share this report with their primary care doctor, cardiologist, or other healthcare provider. So what we were seeing on our review screen as a clinician can also be shared by the patient to their own care team for coordination. Now let's empower our patients to get with the guidelines. At this point, Derek's been with the program for a few weeks now, and this is an opportunity to use the data that we're getting from our wearables, from the information that we're gleaning from the dashboard, and really build on it. So for Derek, who's had a heart attack, we focused in on LDL-C reduction. And when he takes a look at Corey, he can see that his range is 84, he's at 84, a range really being in the higher, a little slightly elevated, trying to get him less than 70. This is a point where our Corey coach is able to work one-on-one with Derek and make a suggestion that in addition to staying with his statin, we can get him to the American Heart Association Heart Kitchen to help improve his diet. So Derek had the opportunity to go to his community heart kitchen and take his family and learn how to cook heart-healthy diets. Let's take another example here of how we empower our patients. So here's another view of where we can really dive in and provide additional metrics for our patients to get an example of how they're doing. We can give them kudos for good work on keeping their blood pressure goals below 130/80, the heart rate that's within that safe range that we're aiming for, and good weight control, as well as keeping track of their mood. So this is a way that they can get closer insight. Here you can see where Derek's checking, and look, all of a sudden his cholesterol is at a better range, and it's been in a better range since he got that feedback from his Corey coach and started going to the heart kitchen. So this is an example, again, of how we can really work on providing that specific feedback and empowerment. We also have really top of the line education, whether it's an article or video that inspires our patients to improve their diet, nutrition. If they're smokers, we give them actionable resources like 1-800-QUIT-NOW so that they can actually get those free resources and quit smoking. For diabetes, lipid, and blood pressure management, we do everything we can to help inspire them to do well at recording their vitals and keeping up with that goal of less than 130/80. And with our education, we love to give our patients kudos and positive feedback. If they complete all the learning, their heart fills with gold, and we're able to give that reinforcement that they're doing an awesome job. We can also see on the dashboard if there is room for improvement. For example, if they're less than 80 or 90%, we might make suggestions about how they can improve their learning. We also have the opportunity to have precise education that's really prescribed to our patients based on their comorbidities and health risk factors. So this is an example of how we empower our patients to be more engaged in their care. This is the exciting phase where really Derek has been engaged in the program for 36 sessions, and it's his graduation from the program. But we really view this as a way to maintain heart healthy routines and stay engaged and connected. For example, we encourage our patients to join us. This is the most recent Maryland Heart Walk this year with our Corey and Johns Hopkins team, and at the Heart Kitchen, where we've cooked meals and helped prepare food for our patients and for our community. So these are great opportunities to graduate and also maintain heart healthy lifestyle within our community. We want to scale this type of innovation to provide patients and adults here in the US equitable access to cardiac rehab services anytime and anywhere. Like was mentioned earlier by Alexis, we live in a country where there's deserts. If you can see all this light blue, this is where there are no centers. But we envision that with virtual cardiac rehab, hybrid cardiac rehab, we can build more opportunities for patients to receive services and reach everyone around the globe. Now imagine if instead of those 10 to 20% of patients that are now receiving those services, if we're to empower and change and innovate our program so that patients like Derek, who would have been left out of getting cardiac rehab, are now served. Imagine patients like him, and we can reach patients across the country who need our valuable cardiac rehab services by doing this innovative approach. I want to thank you for your attention. I want to thank Dr. Martin, Dr. Ali, Dr. Matthews, and Dr. Azakazde for all of their incredible work and effort in this project. Thank you so much.